And good evening, everybody, and welcome to this week's Maternity and Midwifery Hour. I bet you thought there was going to be a launch of a kind of rocket or something, especially with all the talk of these beautiful pictures and images coming from outer space. But no, it's the Maternity and Midwifery Hour. And I'm delighted to welcome two wonderful speakers this evening. We have Diane Garland and Holly Blake. And because we always do this to and I say this every week, we always do this to our lovely presenters, we ask them to share just a little moment of the week to start things off. So could I ask Diane perhaps to share her moment of the week, please?
I
Wonderful.
certainly will. Thank you very much. It's quite a big moment well, it's actually a week and a bit. It's been a very week of Indian things for me. Started last week with having lunch with two colleagues who I met back in 2016 in my first ever visit to India. Ali Sullivan, who is a midwife therapist now in Hong Kong, so it was very international, and Lina Duncan, who is an American trained midwife but now working as a doula in Brighton, so that started it. Then on my way back to the railway station, I met in a coffee shop two lovely Indian couples who were, well, first of all, overwhelmed by what I was wearing because I always wear my Indian outfits. And then to finish it today, I listened into a Zoom for another company, and my lovely colleague, Dr. Vijay Krishnan from Hyderabad, where I'm a midwife consultant to her birth centre, the Sanctum. And that sort of finished off my Indian week so far. So it's been fab for me. I love India and it's just been great. So thank you, Sue.
And wonderful. Thank you for sharing that, Dan. And we noticed there might be a few Indian themed backgrounds there.
Yes, just a few for
just
my
a few.
stars.
Wonderful. Thank you so much. And Holly, welcome to the Maternity and Midwifery Hour. Do you have a moment you can share with us this evening?
I do, and it's less of a week and more of a single moment, but it was a rather nice thing where over 10 years ago, I supervised a student who is a lady from Malaysia who was over here doing a project on young people and diabetes, and she collected her data over in Malaysia, and I supervised her PhD. It was quite a long time ago, and we kept in touch for several years, and then we lost touch. Anyway, she got in touch with me this week and it was absolutely lovely. It was just a really warm, fuzzy moment where we could connect and talk about, some of the things from years ago and the job that she has and her family and, her plans going forward and everything that she'd done. So it's just a really nice thing because we invest a lot of time in people as academics.
Absolutely.
We invest a lot of time in the people that we supervise, and it's so great to see where they end up and what they're doing and just stay in touch.
Fabulous. So, I mean, really, that's two wonderful examples of friendship that carry on, that start and carry on over the period of time. Fantastic. Thank you so much for sharing those little moments. Now, we're going to let you have a little rest before we start the main event of this evening. And I just need to sort of say again to our audience a big welcome. I know some of you there are old friends because I know I spoke to somebody this morning who is an old friend and comes every week. And I know there are a lot of you like that. But there are some new people with us, so welcome to you. And just to kind of let you know a short story of the Midwifery and Maternity Hour. We started at the beginning of the first lockdown in the pandemic of 2020. I can't believe it's 4 years ago now. And it seems in some ways a long time ago, and in some ways it's just a moment ago. And what we needed to have something for midwives, student midwives, anyone who's working the maternity services, to have a connection, to get some information. And at that time, initially, we would put a lot of information about COVID-19 and also about changes that were going on in maternity services, how midwives were coping, how students were coping. So we had a lot about service development, and we also had a lot about caring for each other and caring for yourself, which is kind of slipping into today, which is lovely. But as you know, it's carried on because I know COVID's around still, but we are now allowed to meet face to face in festivals and conferences and study days. But we've carried on with this weekly 1 hour information sharing and connection with midwives and student midwives, etc., because people seem to like it, which is great. And just to let you know, just in case you have a power cut and you lose everything or you go offline, don't panic, because everything we do, and that includes the Maternity and Midwifery Hour and the Maternity and Midwifery Festivals, is recorded, and you can access it through the lovely Matflix. And if you go into the Matflix website, and you'll see that on your resources sheet, you can get to see anything and find anything you'd like. Brilliant if you're doing a project, a dissertation, an assignment for work, or a project for work, or if you're doing for the midwives in the UK for your revalidation. Really useful, really useful. So do access it if you can. And do you know what? I didn't even introduce myself right at the beginning. How shocking. What a blooming awful chair I must be. Sue MacDonald, the curator for the Maternity and Midwifery Hour and the Maternity and Midwifery Festivals. Now, the other thing I need to say is that I want to say a big thank you to everybody who's working their socks off, looking after women and babies and families, and doing your bit to keep everything going. And I don't think it's stopped being stressful, and it hasn't stopped being short-staffed and difficult, but people have carried on. And we know that though there are some blips in the service and things that we do need to address, for most women we get it right, and we need to bump that up even more, so mums and babies and families are beautifully cared for, because that's what's close to all of our hearts. Also, look after yourselves, because that means that you can look after women and babies and families as well. So that's going to be kind of at the centre of what we're going to be talking about a bit later. Now, news. This is my little news feature. It's International Guide Dog Day. I'm sure not all of you knew that. And I knew that because I go onto Twitter, and some of the people I follow have guide dogs, and they're obviously celebrating it. And you get a real feel about how important it is for people to have guide dogs. So that's good to celebrate. It's also still Stress Awareness Month. So use the lovely Action for Happiness calendar, which is my great favourite. Now today, and I know it's a bit late for this one, this has a little thing every day for you to do. Something mindful, something not worky things, just something lightweight, really. Just think something different. Now, last week I sowed my seeds. That was what I was meant to do. There's no sign of anything coming up, but you'll be the first to know. But today's task is get active in nature. Feed the birds or go wildlife spotting. Now, it's a bit late in the UK for that. So I'll just tell you tomorrow's is have a no screens night and take time to recharge yourself. So you can take a choice about what you do, and you can move these around if you wanted to do. But I think this is fantastic. That's also on your resource sheet. Okay. Now, it's also I've got the Cochrane review for midwife continuity of care versus other models, and that's still on the resources sheet. And of course, I'll say again, like I said last week, if you were watching, if you haven't accessed a Cochrane review, this is a really good one to start with. Really excellent. They are really the pinnacle of evidence. And I know Diane would think, because Diane will be nodding away with that. This is the one, the intervention that's been described of. If continuity of care was a drug, it would be a blockbuster. There you are. That's your homework. Also, just to let you know, the Black Maternal Health All-Party Parliamentary Group, which is the APPG, is now on day 3, and it's actually day 3 of Black Mental Health Awareness Week. So I'm sure they're going to report on what they've been discussing, because it's an opportunity to discuss issues and bring evidence forth and experiences that women are experiencing in families. Also, on that kind of note, the Sands and Tommy's charity are calling for evidence from anyone working within midwifery and maternity and neonatal services to understand, in terms of loss and bereavement of babies, what needs to change. And again, there's a link on the resources that you can go in and put your 10 penneth of what you think should be changed. Now, this evening, and this is perfect timing, so I've recharged from the forgetting my name for a minute. We're going to focus on health and well-being and, of course, work-life balance, which we all need to be aware of for our own self and our families, and to carry on doing what we do, because it does take a lot out of you, and we all know that. Now, we're going to start with, I'm going to start introducing Holly Blake. Now, I'm going to say this is edited highlights because Holly is a very talented and very busy person who's just owned up to me that she's done a 12-hour day today, but you wouldn't know it. She's fresh as a daisy. Now, Holly Blake is a full professor of behavioural medicine in the School of Health Sciences at the University of Nottingham. She's co-editor of what she'll be talking about a bit today, which is Health and Wellbeing at Work for Nurses and Midwives. She's got over 25 years worth of research experience in public health, particularly in health services, and expertise in health promotion and health behaviour change and patient experience. She's got a particular interest in workforce health and wellbeing across the sectors and employment settings, and she has expertise in health and wellbeing of the NHS and health and care workforce, and was advising during the COVID-19 pandemic. And she's rightly listed in the top 2% of cited scientists. So that's fantastic to welcome Holly this evening. Thank you so much for coming, Holly, at the end of your very busy day. Welcome, and now the screen is all yours.
Thank you, Sue. It's fantastic to be invited here today to have the opportunity to speak to you. And I'll just, if you can see it, I'll just flick onto the book here. I don't know if you can see that was the book I'm going to talk about. So I'm a health psychologist from the University of Nottingham with an interest in work and health. And as you can imagine, this is a topic area that's gained a lot of traction since the COVID-19 pandemic, when the need to focus on staff wellbeing became very apparent across the UK and globally. And working very closely with Gemma Stacey from the Florence Nightingale Foundation, we've edited a book called Health and Wellbeing at Work for Nurses and Midwives, and it was published by Elsevier. And if you've not seen it already, I'm really excited to introduce this book to you that's got contributors from across the UK and beyond. If I could just have the next slide, please. There we go. Thank you. There's no doubt that fostering a healthy and happy workforce is good for everyone. Health and wellbeing in the nursing and midwifery workforce has long been a consideration, but it's not always been prioritised. With concerns about the retention of early career and established healthcare professionals rising, we're seeing an increased commitment to systematically addressing the factors that influence and undermine health and wellbeing across health and social care environments. So in this text, we're providing practical and accessible guidance to nurses and midwives on how to manage their wellbeing at work. And we're proud to have coordinated the input of 36 contributors with expertise in nursing, midwifery, in workplace health and psychology, who've offered their insights informed by theory, research and policy. And we hope this book is going to be helpful to individuals who are looking to enrich their own wellbeing and experiences at work and those of their colleagues, to team leaders who are committed to creating team cultures and working environments that foster wellbeing, and also senior leaders that have the power to influence policies and practices within organisations that have the potential to embed wellbeing into the fabric of the clinical environment. So the style of writing is largely conversational so that we can make it accessible, and the chapters are purposely short and focused, ending with 5 key recommendations and a practical activity to help readers to translate their learning into practice. And we've put in case studies throughout that offer examples of strategies that have been successfully implemented to support and enhance wellbeing of the workforce. So what I'm going to do now is just going to run through the structure and outline of the book for you so you can get a bit of a feel for what it's about. Next slide, please. So in section 1, the case for health and wellbeing at work, here we're outlining the cost of ill health to employers, and we provide a business case for organisations to invest in wellbeing by outlining the cost to employers of ill health in the workforce. And we offer perspectives on the way in which health and wellbeing can be impacted by the health and social care environment and the nature of the work that midwives and nurses engage in on a day-to-day basis. And within this section, we demonstrate why health and wellbeing needs to be a primary consideration for employers in terms of the impact of health and ill health on individual workers, on the workforce as a whole, on the organisation, but also how it impacts on the quality of care that nurses and midwives can provide. So in this section, we've got a number of chapters: why healthcare employers should promote health and the costs of ill health at work, caring for yourself to care for others, prioritising self-care, how staff wellbeing relates to patient experiences of care, how stress and anxiety affect the body, and understanding compassion, fatigue and burnout. I wanted to share with you an extract from chapter 2 that was written by my colleague Joy Darch, who's a retired nurse and academic from the University of Gloucestershire. And it's an introduction to her chapter, and she sets the context for self-care. So just bear with me a moment while I have a look at the book. Caring for yourself to care for others, prioritising self-care. This is the words of Joy Darch. Have you ever wondered why some nurses and midwives do not prioritise self-care when they're so good at caring for others? It's an occupational strength that the nature of those attracted to the nursing and midwifery profession have a desire to meet the needs of others, which attracts those who are often givers in nature. This chapter considers the dilemma for such caregivers to balance care for others with care for themselves when the lives of others are the focus of every day on the job. Working in an environment when the human needs of others are priority and often urgent, it's quite easy to lose sight of your own needs. Have you ever missed a break, become dehydrated during the day, left work hungry and grabbed an easy high-calorie snack before falling into bed exhausted? Sound familiar? Those that support others in times of intense need mostly have a nurturing quality, which is often evident in both work and home life, and it can manifest itself in never putting themselves first with family and friends. Ever felt exhausted when still agreeing to do a favour for someone? Felt guilty when saying no? Listened to a friend's problems for an entire evening without sharing your own worries? As one experienced nurse explained to me, for many, giving in does not come as naturally as giving out. So that was Joy's words. And there's also a great chapter on understanding compassion, fatigue and burnout that was written by Dr. Sally Pizarro, a midwife from Coventry University. And her chapter includes a case study with an activity which actually gave me goosebumps when I first read it. It contains a script of an audio artwork entitled Boats on an Ocean. And this piece was inspired by the narratives of healthcare professionals working during the pandemic as they reflected on their experiences. And it was written by writer and director Nick Walker following an innovative arts-based research workshop that Sally hosted with China Plate Theatre as part of the Humans Not Heroes project and the Coventry Creates initiative funded by Coventry University and the University of Warwick for Coventry City of Culture 2021. And all of those scripts are included in this book. The audio itself is accessible by QR code. And if you have the book, I recommend you access this, because as the healthcare workforce, you may well relate to some of these pieces. But I warn you, they do spark some emotions. It wasn't something that I was going to read out. They're quite emotional. Could I have the next slide, please? So we're on section 2 now, which is about managing emotions in difficult times. And this section advances to explore the ways in which ongoing concerns that diminish well-being can progress into more significant challenges associated with mental health issues. And this section is intended to highlight the early warning signs of a deterioration in mental health and offer strategies that destigmatise and encourage an open dialogue amongst nurses and midwives about their mental well-being. And chapters focus on how to manage emotions in challenging times. So understanding our emotions, how to open and start conversations about mental health. I co-authored that chapter myself, dealing with anxiety and low mood. Next slide, please. So this is about wellbeing needs at different times. It's section 3 of the book, and it's a discussion of the varying wellbeing needs that impact at various stages of our careers or because of different job-related or lifestyle factors. And it's very much an acknowledgement of the transient and fluctuating variables that can impact on wellbeing. And it emphasises the importance of certain strategies that are targeted to meet the unique needs of a diverse workforce with different working patterns. So we've got a chapter on sleep work, shift and managing fatigue, and that's coupled with a case study from Newcastle Hospital's NHS Trust about a fatigue risk management strategy that was established in maternity services. There's a chapter on wellbeing needs during periods of fasting, and that's got insights in it from the British Sikh Nurses Association. There's a chapter on mental wellbeing in nursing and midwifery students, and one on wellbeing and late career nurses and midwives. Next slide, please. So section 4 is the biggest section, enhancing wellbeing at work. And this offers examples of factors that enhance wellbeing in the workplace. What can we do about some of these issues? And underpinning this is the creation of psychologically safe work environments where nurses and midwives feel encouraged to share their challenges and raise their concerns. And it's argued that that's the foundation for wellbeing interventions, strategies and innovations to be received by the nursing and midwifery workforce as a valued investment in them and their holistic health. And this section also includes a focus on strategies for self-care and healthy lifestyles. And it concludes with the learning that arose from the psychological impact of responding to the COVID-19 pandemic. So we've got a range of examples for chapters: creating psychologically safe work environments, clinical supervision, developing teamwork and social support in multidisciplinary teams, enhancing health and wellbeing through shared governance strategies, and a chapter on Schwartz rounds and how that can help to manage emotional and social challenges of the job role. We've also got a chapter on supporting distressed colleagues using psychological first aid. And then we move to healthy lifestyle behaviours. So we talk about things like being physically active, looking after oneself, healthy eating, diet, obesity, and the impacts of dehydration and staying hydrated at work. And we conclude with a chapter that I co-wrote on the challenges of health and wellbeing in a crisis that arose from the pandemic. And that chapter is a bit different to the others. It's got a range of case examples of best practice that occurred during the pandemic, providing lessons learned for future crisis situations. I just want to tell you about one example, which is something I was quite closely involved in. So case 2 in that chapter is about wellbeing centres and psychological first aid. So from the early stages of the pandemic, health and care organisations rapidly created respite spaces for the workforce. And in the literature, they're described in loads of different ways: wobble rooms, timeout rooms, wellbeing centres, and so on. And the nature of these spaces, what they're called and the provisions for staff might vary, but essentially they're premised on the assumption that staff need rest, they need recuperation, they need a place where this can happen, and that needs to ideally be outside of their clinical area. And these sorts of spaces are intended to encourage people to take work breaks, provide quiet spaces for relaxation, areas to eat and drink, and opportunities to socialise with peers and access support, albeit it was with physical distancing during the pandemic. But I just want to give you a really nice example of this, because in the UK, Nottingham University Hospital's NHS Trust really led the way with staff wellbeing support in the early weeks of the pandemic. 2 wellbeing centres were set up in April 2020, providing high quality rest spaces and peer-to-peer support, psychological support from staff volunteers called wellbeing buddies, who were trained in psychological first aid. And these centres were open to all staff from any job group, including nurses and midwives. And at the University of Nottingham, we led the first evaluation of the implementation of supported COVID-19 staff wellbeing centres globally. And these centres were really highly accessed. So over the 17 weeks of the first wave of COVID-19 in the UK, we recorded almost 15,000 facility visits across the 2 facilities in a single trust. And we did some qualitative research, some interviews that showed that wellbeing centres and access to psychological first aid was really valued by the staff, who viewed these provisions as critical to the wellbeing of hospital employees during and after the first surge of the pandemic in the UK. And the impacts were wide-ranging. So attendees of the wellbeing centres reported loads of benefits for individuals, their personal wellbeing, for teams, team cohesion and social support, the healthcare organisation, the potential for this wellbeing intervention to prevent sickness absence through timely support and giving people that time out, and also an impact on patient care quality through improved individual team wellbeing, supporting productivity and compassionate care. And our research highlighted the importance of managerial support, actually, and role modelling in staff wellbeing service access, because staff told us that they were more likely to access these centres and psychological support if they felt it was sanctioned by their line manager, or even better, role modelled and advocated by managers and colleagues. Although we've got loads to learn from the rapid implementation of these sorts of facilities for health and care workers during the pandemic, it should be emphasised, as it was earlier by Sue, that rest and recuperation and access to psychological support and self-care is essential elements of supporting staff wellbeing always, and not just in a crisis. And we end this book with our final chapter commenting on the future of health and wellbeing at work. And again, that was one that I co-authored. So just to summarize, throughout the whole of this book, we take you on a journey that starts with the business case for why organizations should invest in the health and well-being of their workforce. Why should a trust put money into this? And embed well-being into their organizational policies and practice. We introduce some key areas of health and well-being and provide strategies for the actions that we can all take to maximise physical and mental health and support the well-being of ourselves and others. And we discuss health and well-being in the specific context of the nursing and midwifery role across the whole professional career, from students through to senior leaders, even through the most challenging of times, like a global public health crisis. And at all times, we ask the reader to think a lot about the issues raised in our chapters by engaging with the activities involving reflecting or planning. And through all of the case studies, we want to inspire readers by showcasing innovations implemented by individuals, teams, or organisations across the health and care sector, with ideas that people can go back and model in their own trust. And our hope is that readers will use this information to make a difference where they work or study. Individual people, we're not just passive recipients of health and wellbeing initiatives. All of us play a really key role in creating and sustaining environments where people feel supported and can flourish. And we hope that this book is going to help nurses and midwives to advocate wellbeing and improve the working environment for themselves, for peers, for patients and clients. I'll hand back to Sue.
Thank you so much. I was just looking at the the last section and thinking, and I'm thinking as a teacher, I'm thinking this would make a really good theme to go the way through the curriculum, actually, for making sure people learn how to care for themselves right from the start. So thank you so much for setting the context on it, Holly. I think I do have a question, and if I don't ask it, I must ask at the end about because you've got me thinking about something in there. So thank you so much for starting us off there. So if you have a question for Holly, just go through in the chat room as usual, and it'll come through to me, which is why I'm looking over there. So at 1:45, we can share and have some discussion at the end. Fantastic. Now, next, I'm delighted to welcome back Diane Garland, who qualified as a midwife in 1983. People will know Diane for her water birth work, because she's published extensively and she's also presented all over the world and also the UK on that. And a real good resource into water birth, very focused on evidence-based, which is fantastic. She also works as an expert witness, university lecturer, and until recently maintained clinical skills on a midwife-led unit in Kent. She's had loads of roles, including professional advisor in Chinese and Indian birth centres, which she's already mentioned, and also has a company, midwifeexpert.com, where you can have a look at her website and reach her if you need to or want to. And her roles have expanded in the UK and abroad. And also she is, of course, an honorary, a fellow. No, you're not an honorary fellow. You're a fellow of the Royal College of Midwives also. So welcome, Dan. Thank you for coming. And the screen is now yours.
Thank you very much. Hopefully you can hear me, because I know there's sometimes a little delay. So thank you. This is hopefully going to challenge some of you. That's what I always say whenever I'm teaching anything, but it does fit in. I didn't know what Holly was going to say this evening, but it also fits in with any of you who watched last week's session as well. So, you know, we do complement each other, but we don't always know what each other are going to say. So hopefully you'll find this engaging this evening. The reason that we gave this title of a work-life balance within a changing midwife role is because my role has changed dramatically over all of my career, which is now into its 42nd year. But it's done it because my life has changed. In the middle of my life there with my midwifery, I actually got married. So that was a real balance for me. But this is how I work now and how I maintain my health, because I'm slightly more mature midwife than many of you may be, but it's still important that we keep this balance. So I thought, first of all, well, anyone who knows me knows I'm a very typical Capricorn. I'm a very, very, very organised person. And that, for me, just boils down to a very organised diary. And yes, I still have a paper diary. Holly showed you her book. My book's more boring. It's just a paper diary. But for me, the biggest thing is it's all colour-coded. So I know when I'm looking to do something, I think, well, have I done that in the last month or last week or whatever? And that's how I start to get my balance of my work during a week or a month. The other thing that balances that is a lot of my work is abroad, which I'm very, very fortunate to be able to do. And I still love this photo. This was one of our first trips with an American colleague to India. But if you can see in the background where I'm standing at the podium, which is not me, which is why I found Zoom so challenging. I'm not a standstill person. But behind us, it actually says the School of Ancient Wisdom. And I've always hung on to that because I think sometimes we negate where our leaderships come from. And Holly's mentioned it, and it was certainly mentioned last week about leadership. So, yeah, that's me and my balance, my beautiful diary, and just really balancing with where I've come from and where some of our colleagues have come from. I work with a lot of different organisations. I think this is all of them, but I can't guarantee it. I did go through my diary. Some you may recognise, many are UK. Some are charities, some, like Maternity Midwifery Forum, obviously have a high profile for us. I do work for the Care Quality Commission. I work abroad as well with various organisations. I mentioned the Sanctum on my moment of the week for me. And that's been my passion about getting information, as Sue rightly said, evidence-based information out to any organisation, charity, anyone who contacts me. And some might be very unusual to you. You may or may not have heard all of them, but as Sue said, everything is taped. So if you don't know about any of these organisations, then obviously you can look them up. I just slid in at the bottom there, the Expert Witness Directory. Because I work freelance, this work is not going to be covered by the Royal College of Midwives, who are there because, as Sue very kindly said, I am a fellow. So that's just something I had to be very aware of. So I guess that's not just personal well-being, it's professional well-being. I have to make sure that I'm covered legally when I'm doing some of these roles, particularly if they're outside the UK, because the RCM would not cover me, and rightly so, in some of the roles that I do elsewhere. So how do I balance my time and my well-being and my life? So on one side, I've got what I really do, which I've started to mention. Certainly a lot of face-to-face teaching, thank goodness, back to that. But as Sue said, you know, the midwifery hours started during the pandemic, so all my teaching had to go live onto Zoom. And I have found that very hard. Trying to teach water births in an office is not easy. And I had a terrible habit of keep disappearing out of the screen because I was going down to get a piece of research or something. So that was a real challenge to me. And it was something I did find hard. I wasn't lonely, but I did find it hard. I always write. I love writing. My reviewer is my sister, who will get mentioned a bit further over. And I've just started to rewrite a water birth book, which I will get out next year. So anyone interested, please email me. I'm after stories and photographs. I do book reviews for one of those organisations in America. So I get some very, very interesting books to review. The one I've got at the moment that's on the go is about Ebola, which you might think, but it's lessons to be learned. When COVID first hit, one of the big things I found was remembering the lessons we learnt when HIV first hit. So the Ebola one, because I have heard the author speak, so I know what's in it, I think it's going to be a very interesting one for me to review. But I've got another one to finish first. So, yeah. I do research, not always primary research. Sometimes I help with things like meta-analysis or give guidance to people on a very simple level. If they're starting up a water birth or a birth centre service, what data they need to collect, real basic stuff. And then please publish it. That's my big bugbear. If I go to different countries, and I was in Poland recently, and they do water births there, but you try and find any research. So I nagged the Polish. So let's hope we get some articles from them in the next year or so. They collect the data, but they don't share it, which is just madness. And then I do have a lot of consultancy roles for parent organisations as well as other organisations. So doing all that, how do I keep my sanity and my well-being going? I call them refreshing lunches. I mentioned about meeting my Indian colleagues last week. From a business point of view, they're business lunches. And we do talk shop, but we also talk about our own health as well. And, you know, are there any big challenges in our business lives? There aren't many freelance midwives out there. And those that there are have a very, very close network. And luckily, one of my colleagues lives very close. So we have lots of refreshing lunches. I briefly mentioned, but I couldn't do any of this without my family and friends. I don't have a manager anymore. I don't really have another leader. And they were very important in the early stages when I was still working clinically and setting up the business. But my family and my friends have been amazing. My sister, as I said, is my book reviewer, and my husband, Howard, just sits and nods and, yeah, you do if you want to do it, Diane, and if you don't, that's fine. He's not medical, so actually having a sounding board like someone like that, I find amazing. One of the other things that I had to start doing to help a neighbour was at the height of COVID, and he was one of the people told he had to stay at home because he had quite bad COPD, lung disease. And he wasn't worried about himself, but when he phoned me, he said, I've had this letter. I don't know what it means. And of course, he read it out and it said he had to stay at home. He said, but what about the dog? He wasn't worried about himself. So I started dog walking, and here I am 4 years later, different dog, sadly, the other one passed away, but I now walk backs. And his big treat of the week, maybe I should have asked him what was his tip for the week, is we go to the local pub. We walk down there and we go for a drink. We only have coffee. Max has chews and gets well petted. So the dog walking is really important. And Holly very kindly said about exercise, but that to me is one of my exercises. I also joined an exercise class in the village. So it's got me to know my village much better than I did before. And we call it drum fit. It's basically a big birth ball on a big tub with drumsticks to music. So we do have fun with that. And the group are very, very varied in their age and their backgrounds, but they're all local to my community. Also, I help the community cupboard, which is our food bank. We don't call it that. We like to sound more positive. So it's our community cupboard. It is very much a community-based cupboard. I phone them up when I go shopping and say, what do you need? Last week it was noodles and coffee. So I do get some funny looks when I check out at Asda, because I've got like 15 bags of noodles and 10 jars of coffee. And I'm not saying it to be, this is how I feel I'm helping my community, which is part and parcel again of what Holly said. We come into the profession to help. So I really enjoy doing that. And they're a great crowd up there. So one of the photos there leads in beautifully to these reflections on colleagues and maternity services. That was taken at the Maternity Midwifery Festival in London. So not long ago, and I'm in the pink. It's a pink Indian top, as you probably guessed. In the middle is Becky Reed. If you haven't read her book, Closure, it's worth reading. And Caroline Flint, which I hope a lot of people will know. And I don't know what we are. Are we the mature midwives? Are we the elders? I'm not sure. But I always say to everyone, please utilise us. You know, we have got a wealth. Between us, we believe there's about 120 years of experience there. Yeah, because I asked them how long they've both been midwives. I know how long I have, but yeah, about 120 years of experience. Sue mentioned the portfolio for revalidation. That becomes a challenge, particularly when you move outside, as I have now, of the NHS. You have to be far more creative, but still fall within the remit of revalidation. And of course, finding somebody who can and will revalidate you, because it was difficult within the NHS because only a fraction of my time was actually taken up with pure clinical hours. So again, anyone wants some advice and support, I'm here because I've had to learn in the last few years. Holidays, very important. It goes back to this break issue and having your own space. And I love skiing. So that was me this year, in Flaine in France, skiing. My husband and I just go, this is our time out. A lot of the time, as Holly said, we think about friends and neighbours, and we're often the last one. So skiing for me is my real time out. And then my cat, because I mustn't forget Ozzy. He's my little buddy. And all through COVID, he used to just sit at my feet. He almost could sense that something was going on and that his mum needed him. So Ozzy is my baby. And he's been absolutely fantastic to me all the way through. So it's a very unusual way I work. However, everything that Holly and the colleagues last week talked about certainly all fit into this. If I had to pinpoint one thing, it's about being organised. And I know not everyone's going to be a Capricorn, but if you look at Capricorn traits, we are known for our organisational skills. But I'm very happy and have helped colleagues over the years to try and find their way through this. But certainly being organised for me keeps my health and my well-being going. I hope that's helpful. Thank you, Sue.
I love this sort of health and wealth, Diane. That was wonderful. Absolutely fantastic. And the diary, we all have them. The funny thing for me, when you said about a diary, I'm thinking, well, actually, that's one of the things in practice. The community midwives are really good with diaries. But if you're hospital based, I'm not sure that you're as diary focused, because I know when I went into education, I was a bit shocked when the lead midwife gave me a diary and I was to fill it in. I'm thinking, don't I just come to work? So it's a good example of getting organised. But I'm a Pisces, so I'm a bit scatty on that. So there we are. You're a model to us all, I think. So thank you for that, Dan. Now we have got a few questions. And the first question is from Patience Pounds. Hi, Patience, how are you? And Patience wants to know anything on wellbeing needs during that time of the month. I feel this is a neglected area when it comes to wellbeing. Now, it's interesting, Patience, because I think a lot of focus has been recently, and rightly so, focused on menopause, hasn't it? But I'm not sure when you were looking at the book, Holly, whether you had very much about the time of the month or the different
it's not included in the
cycles.
book, primarily because that we just ran out of space. There were so many more topics we could include. However, I have been involved with an initiative run by a colleague at the University of Nottingham called Project Period, which is and the aim of that is to encourage people to open up conversations around menstrual health, around menopause, perimenopause, menstrual disorders, around period poverty, all of those things that affect people's mental well-being. And we did some surveys with staff and students, and they were talking to us about, being caught short, not being able to afford period products, not feeling comfortable to discuss with line managers when they've got menstrual issues at work, and menstrual pain, fatigue, headaches, and so on. So there's been an awful lot of work done at the University of Nottingham around that. And we have recently published in Perspectives in Public Health a roadmap to establishing Project Period that shows what it's about and how it was developed and the rationale for that. So I probably could have included it in the resources, but I can certainly send it on if it's useful.
Okay, well, that sounds good. I mean, it's something, I think it's got mentioned recently, because of the stories of midwives not even being able to go to the loo during their shift. And obviously, if you're having a period and if you have a very heavy period, that's a big issue. And I think we're often a bit shy about saying anything, even to our female colleagues. I don't know, Diane, I don't know if you want to add anything to that.
No, I mean, it's very true, because obviously I'm at the other end of the spectrum, and luckily didn't suffer from terrible menopausal symptoms. But I can certainly remember a colleague who was going through the menopause, and she was of a different ethnic background, and she found it really difficult. And yet you could see at meetings, the redness just going frump, and she'd open all the windows, and the rest of us would all be freezing. And eventually one day we said, we've got to talk about this, because this is, this shouldn't be in our health system, something we don't feel comfortable to talk about. So yes, I think you're right. It's about being open, wherever we are on that spectrum, there will be symptoms. I have no problem telling people I had terrible periods because I had awful fibroids, which I probably ignored for 15 years until I almost collapsed one day at work. And that was because I couldn't get to the loo because we were so busy. And it was one of the obstetricians that physically picked me up and said, Di, what's going on? And it was he, and he was a gynecologist as well, and he was the one that sorted me out. But I had just ignored it. I didn't realize how low my hemoglobin had gone, and it was very low. And I didn't look after myself because I was looking after, mums, babies, and the families. So yeah, it can happen to us all, however we think we're good at doing things. And I suppose before I left the NHS, I was far more conscious of it. I would make sure people did get a break, and the big thing, go to the toilet. So yeah,
I think that's the key issue. I think there's a few things going on. I think it's the culture of not taking work breaks, combined with the need to raise awareness amongst line managers of all issues that affect health and well-being, whatever they might be, how difficult they are to talk about, to actually create psychologically safe environments where people can talk about anything. So we often talk about psychological safety in the context of mental health, but actually it's in the context of anything that impacts on health and well-being, which could be financial issues, it could be menstrual health, it could be mental health, it could be anything that people find challenging to discuss in the work context that impacts on the way in which they interact with other people and the way in which they can perform their job. And certainly work breaks is a key aspect of that as well. So
and this is very important. It was quite interesting. I was talking to a midwife this morning who was saying she had a colleague who used to come to her and say, go and have a cup of tea just for 10 minutes. And she's doing it to herself now, to her colleagues. And I think it's important each of us take on saying, just checking in on each other. It's just being like human, but it's about caring about the physical and mental care. I mean, I think Diane just illustrated what you initially talked about, Holly, about us coming in and being caring and looking after everybody else, but not ourselves. You've done a beautiful illustration, Diane. So well done. Thank you for that. Okay, now
it does sound like a bit of a cliche, but I guess the phrase "you can't pour from an empty cup," it's so applicable across all situations. So.
Absolutely. And it's worth the investment in our people. It's really important. We haven't got enough staff, so we need to really nourish and nurture the ones we have, all of us, every single one. Now, we had a query from Jerry. Hi, Jerry. Jerry wants to know, where can we get the book?
Oh,
Now,
Well,
I think Jerry means Holly's book. Diane's book is still available on all good shops and Amazon, but there'll
yeah.
be a new one next year, so hang out for that as well.
Yeah, well, the book is here. The book is here. I have my own copy that I was sent from the publisher. If I don't know if you can see that.
Yes, we can.
That's what it looks
Perfect.
like. You can get it from the Elsevier website. It's actually also available on Amazon, in Blackwell's bookshops at universities. It's available in Waterstones. So there's various places that you'll be able to get hold of that.
Excellent. Be a bit cautious though, because some of the American sites are selling it for a lot, and Holly doesn't get any of those. No,
Oh, no, certainly not.
I guess it depends how available it is. So check
sounds like a
out.
good one for a book review to me, doesn't it?
Excellent, most excellent. Like I said,
Mhm.
I think that would make a good model
Mhm.
for a part of a curriculum for me. I'm thinking midwife teachery. Now, I've got Helena is having problems accessing Diane's website.
Oh, it may be because it's out of date now. I don't really use it that much.
Oh,
It's only there really for point of contact, but my email is at the end of that presentation. So yeah, I wouldn't worry too much. I probably won't think about updating that until the new book's out.
okay.
It looks tired. That's probably well, not me.
Oh,
The website looks tired. So yeah, probably just contact me direct and we'll go from there if anyone wants to. But thank you for that. Yeah.
okay. So Helena, just check out the Diane's details at the end of the presentation. You can relook at it later. Fabulous. Now I did I did have a query, and this could be for Holly and for Diane, because one of the things you were talking about, Holly, which was really important during the pandemic, and I can remember us talking about it, was the wobble rooms, the timeout rooms, the little places. And I did read something, and I can't remember, and Diane would shoot me for this. I can't remember where I read it, but it was recently that said about 50, no, it was high, it was something like 75% of units do not have staff rooms or a quiet space.
Mm.
So where are the wobble rooms? Have they just gone? And I've sent out a question, and for those of you watching, you might know this, whether you've got a room where you can be quiet, where you can have a cup of tea, just a few moments respite from madness. So get back on the chat if you're able to. But Holly, do you know?
I think
Because
that's a
what you were
really
describing
interesting.
was fantastic.
Yeah, it's a really interesting question that you ask, and I have when I've been engaging in teaching with nurses doing master's courses from all different backgrounds, international and national. We talk about this and the space availability, and it's quite interesting to find that lots of organisations that provided respite spaces during the pandemic no longer keep those spaces as rest spaces because the estate's facility is so limited that they've had to use those resources and room spaces for other things. And that's one thing that we've really tried to advocate in our paper, that it shouldn't just be a mitigating response to a pandemic situation. It should be that well-being is prioritised. And actually, we know the impacts of rest breaks. We know the problems with dehydration when people don't have breaks and the impact on cognitive function. We know the impact on people when they don't eat properly, when they don't go to the loo, when they can't concentrate. And that's, has an ultimate impact on patient care as well as team cohesion and individual well-being. So I think it's a really important thing that we flagged in our papers, that it shouldn't be pandemic related. The example that I gave of Nottingham University Hospitals Trust, and they've got a great situation where actually they had a smoking room, and when the smoking ban came into play, that room was completely refurbished and it was turned into a purpose designed wellbeing facility that they actually use for exercise classes, yoga classes,
Oh wow.
complementary therapies, all sorts of things. And that room was one of the respite spaces from the example that I gave you from the COVID well studies. And that room is still there, and it's a protected space for staff wellbeing, and there's a staff wellbeing team at that trust. And I really do believe that, slightly biased because I sit on the steering board for staff wellbeing at that trust, but I've been involved with the trust since 2005, and they really were pioneering staff wellbeing from that point forward. And they were one of the first trusts to set up these centres, and certainly the paper that we published is the first. As Diane was saying, people don't often publish, so there's there's these wobble rooms and spaces around, but we don't know about them. So it was the first figures and data to sort of to present that. But again, it's a really interesting question, and I know that people have said that those spaces have been reclaimed in many environments, and that's something that really needs to be pushed back on, because it's not a pandemic issue, it's a workforce wellbeing issue.
Absolutely. Well, anyone who's listening, if you're having your room taken away, you just need to quote Holly Blake. Get that bit of research and waggle it in front of people. Definitely. I know Diane was nodding away there.
The other thing I was going to say, because yes, I agree. I mean, a lot of those spaces were taken away, but sadly, even during COVID, the space that was offered where I was working was 2 floors down. There was no way midwives were going to be able to get down there and have any time. The best we could do, would you believe, sometimes was just sit in the corridor. It wasn't in our environment at all. Now, that is about, estates, as Holly rightly said. But I'm glad to hear some places did well, because sadly I hear an awful lot that don't. And yes, spaces have gone back to, what they were before. Leaving midwives with, and nurses, it's not just midwives, it is anyone, clerical staff, nowhere.
And medics, of course.
Yeah, of course. Yeah.
So, and in fact, we've had, I did ask everyone, thank you so much for getting back to me. We've got Lisa Routledge, hi Lisa, says our wobble room is initially the sluice. Well, you can't make a cup of tea in the sluice, that's the only thing. And often, maybe I'm being very English about this, but if I'm wanting a break, a little cup of tea is just what I need to just settle everything. We've got Kate Frith, and she says, although the wellbeing rooms were certainly welcome to us all, sometimes it felt like a tick box exercise, which didn't soothe everyone. Can you suggest any way in which they could be evaluated by people other than the non-clinical managers, or ways to keep them from going after the pandemic? Good point, Kate. There might be, I'm sure there'll be someone watching who's looking for a little research project. Maybe you're a student midwife, you've got a dissertation coming up. Good topic. Mental and physical well-being of midwives and students and the maternity team. We've got Kim Gonzalez. Thanks, Kim, for getting back. And she says, have a staff room that's on the ward and buzzer going constantly, no quiet zone. I just feel we could do something with this. I feel we should. And then we've got Lisa. Lisa has come back, Lisa Routledge, but we do have a nicer meal break room, which has been upgraded, especially for us, specifically for us. Mural on the wall, considered lighting and comfy seating. Well, thank you, Lisa. That makes me feel better than the sluice, a lot better. But I think we've got a little way to go. And I think you've got some tools here. And I think midwives can be very creative. I mean, personally, even a cupboard, and like a linen cupboard, could be developed, I'm sure. Anyway, that's homework for you. And I'm just very conscious of the time, because as you know, this hour goes the fastest in the week for us as well as you guys there. And I want to say a big thank you to Diane and Holly for joining us this evening and giving us some thoughts about well-being and health. I think both have got some fantastic books, and they're all accessible. Also, you can dip into these, and they're very. What I like, Holly, is the way you emphasize the conversational bit of it, and then you actually gave that example, which sounded just, forgive me for saying, not too academic. It sounds very practical and very pragmatic, and the sort of thing we can really use in day-to-day practice. but underpinned with this lovely evidence, which we all like. So thank you for that. So big thank you, Holly and Diane, and thank you for focusing, Diane, us getting on the planning and maybe using our diaries for our own self as well, and building in, not saying, oh, I haven't got time for that, making time for, oh, I'll go and have an exercise, do a Pilates class just for half an hour. Oh, I'll go and have a facial just for half an hour. It doesn't have to be that long, just something to look after yourself. So I'm also going to say a big thank you to Angelo, who's at the back doing all the technical stuff to make sure it's all recorded beautifully for you. Remember, this is going to be accessible at the podcast for those of you who are up at 6 o'clock in the morning on Friday for that ready. And Paul for feeding through the questions to me. And thank you for your engagement in this. This has been fantastic. And in the meantime, stay safe and stay well. At least take one or two of the things we've said and try it out and really look after yourselves. Now, next week, we're going to be looking at ensuring a positive clinical learning environment with Maeve O'Connell and Laura Moya Falcon. And we'll be at the same place, same time. Also, don't forget to book, if you haven't booked for the Birmingham Festival, either face-to-face, which will be wonderful to see you if you can make it, or you can book and then join us online. We'll love to see you either way. And in the meantime, take care. See you next week.
Bye-bye.